Hi, I'm Lisa Haupert, and I'm here to talk to you today about having a belt lipectomy or lower body lift. I had my lower body lift 2 weeks ago yesterday, um, and I've got 3 other videos out there before and 3 days after my lower body lift that you might want to look at, and then this one will make a lot more sense to you. But just a brief little history: I lost about 115 pounds at between the ages of 50 to 54 and had a lot of extra skin after that around the trunk of my body. And a lower body lift is a plastic surgery procedure designed to remove that extra skin. It is a huge surgery, and that's one of the things I really want to emphasize to you. This is not a surgery for everybody. It's a surgery that you need to very seriously consider, as far as the aesthetics and how you look. Spanx can often take care of those things for you, and you don't necessarily need this surgery. But if it is right for you, if you and your physician and your surgeon decide it's the right thing for you, then that's why I'm here, because that's what I've decided, and I want you to have some understanding. I'm also a registered nurse of many, many years, and I am a weight loss and wellness coach. So I bring all of that to the table. So the first thing I want to do is show you my incision 2 weeks afterwards. It looks a lot different than it did 3 days afterwards. Both of my drains are out. The first drain came out about 5 days after surgery. It was the drain that went around the front part of my body, around the front abdomen. The second drain didn't come out until 11 days after surgery. It's the one that went around my buttocks, above my buttocks, and that's where most of the trauma occurs. So it had too much drainage in it to pull until about day 10 or 11. I'm going to talk to you a little bit more about that at the end of this. But first, let me show you this t-shirt I have on for you, because if you are considering doing this surgery or know somebody who is, they clearly, or you clearly, have made a major life change, and I wanted you to know that you rock. So, first of all, I still have on a compressive undergarment, and my surgeon suggested that I wear this undergarment for, about at least 4 weeks, 4 to 6 weeks. And I did not have liposuction. I think at that point he might have even recommended I wear it longer. So let's get to it. First of all, there is my new belly button, looking much better. There's still a little bit of glue in there that I haven't gotten out. As you can see, it's still a little red on the inside. But it's looking pretty good. From the side, you can see that there's still a little bit of swelling going on. That's normal. The swelling increases during the day, and that's a lot of the reason that you wear a compressive garment. Moving down to the front, you can see where the tubes came out, which is right there. Those little holes down there are where the tubes came out, and they are healing. You can see the incision on the side. Some of this discoloration, like right here, is just old glue that I haven't yet gotten off. I'm being pretty gentle with that, but I could be more aggressive according to my surgeon. I'm just a little goose about it. This is the front part. This other side. And then what I want to show you, as well as the back. And it depends on your the way your body's shaped, how this goes. But you can see in the very center is what almost looks like a pleat. And I actually call it a pleat. It's kind of like a gather. If the surgeon decides to go over meat in the middle on your back, all the way in the middle, if you were a piece of fabric, they would put a dart in there, okay? But we're not. So instead, it's more like a gather. And over time, that gathering will disseminate across the incision, and you won't have that little pleat there. I know that concerns a lot of people. It will go away. It takes a few months. Inside my little pleat is a wee little bitty open area that I'm just putting a little bit of bacitracin on and making sure I clean it out well twice a day. And again, that's just not uncommon. So not something to freak out over, but definitely something that you need to manage with your surgeon. So I want to talk with you about 3 things. 1 is energy. 2 is the risk of blood clots. 3 is the risk of a seroma forming. Okay. Energy. I was coaching some of my clients this week, and I knew they were going to ask me how I felt. And I thought, well, there's that saying, I feel like $1,000,000. And I thought, I don't quite feel like $1,000,000, but I feel like about $950,000. But my body is not at $950,000. And I know that. I know that here, even though I feel quite well. And so for someone like me, who tends to be a go-getter and wants to get out there, I kind of have to pull back and make sure that I really honor the trauma that occurred to this body. This is a huge surgery. There's undermining of the tissue. There's blood supply interruption. There's an incision all the way around your body. And there's all the risks that go with anesthesia and surgery. So activity-wise, I am walking. I've actually been walking up to 3 miles a day. I feel like I could bend over straight from the waist, but my surgeon's really clear, no sudden bending. So very consciously, I have to remember to squat. I feel like I could go out and probably jog a little bit, but again, he says no impact for 12 weeks. So as far as any cardio I do, it's going to be walking, gentle elliptical, and stationary bicycle. We talked about doing some light weightlifting, and by that I don't mean the grunt and groan type. I mean some nice little hand weights, 2 to 5 pounds, just to keep my upper body strong and those things. So even though you might feel really good at 2 weeks post-op, remember, your body's been through major, major surgery. Okay, just because it's plastic surgery doesn't mean it's not surgery. So don't be deceived. Be calm, be kind to yourself, and give your body time to heal. Okay, so that was one thing. I've got my little notes here for you. Another thing is swelling. Just, you do have swelling. As the day wears on, my belly starts to stick out a little more, and I can look down, and go, oh, what is that? And that's just the tissue that's been traumatized swelling. I'm sure it's happening on the back as well. I just can't see that. Know that that's there. Take a break in the afternoon, put your feet up and rest. That will help decrease the swelling. Wear your compression device and make sure you talk to your surgeon about when, how long, and what is best for you. There's 2 risks, and you've already heard about them from me earlier, but I want to reiterate them. One is the risk of blood clots. And I just go over this and over this because I think it's really important. But I just read an article that's just a couple of years old, that the risk of blood clots is with you for quite a while after the surgery, clearly up to 3 months. The peak of it seems to be at 3 weeks, but there is some level of risk up to a year. Okay, I don't say this to scare you, I just say this to make you aware. Okay, a lot of people who fly into the country or to a surgeon or stuff, very quickly after their surgery will make a long haul flight, and I even know that some surgeons tell you that's okay. I would send you caution about that. I just don't see any reason to do that. Stay where you are a while, or fly a short distance, or drive a short distance. If you do fly and drive, get up, walk. I'm going to be driving down to Dallas, which is 5 hours from where I am right now, in about 2 weeks. And every hour, hour and a half, I will stop and walk around some. You want to keep the blood flowing and moving. You don't want it to get particularly stagnant. You want to wear your compression devices. You want to talk to your physician if indeed they want you to continue to wear the compression stockings. In this study I was talking to you about, there's no particular study on people who have this surgery. It's a study of people who have orthopedic surgeries where there is a higher risk than at this one. And they also include a segment for people who have day surgeries. Well, this isn't a day surgery. This is more than a day surgery, but just let me tell you, there's a 1 in 815 chance, according to this study, of developing a clot, a 1 in 815 chance of developing a clot post this surgery. And in the general population without surgery, it's 1 in 6,200. So again, this is not a huge risk, but it's a significant risk, meaning statistically this is very significant. You get clots because of immobility and pooling of the blood. If you have the symptoms of unexplained pain in your calf or swelling, even several months post your surgery, seek attention. Be proactive, walk, move, ask about wearing compression stockings, ask about flying and driving, be conservative. The other thing that can sometimes happen after this surgery is what are called seromas, which are fluid-filled pockets that develop underneath the skin. And it's from fluid that leaks out of the recently damaged blood and lymphatic vessels. It causes an increased risk for infection and breakdown of the surgical site. It can also occur after the removal of your drains. So that the fluid that was coming out of your drains just collects in your tissues. Now, some of this is reabsorbed, and small seromas will resolve on their own, but larger ones might require treatment. There's several ways to treat that. For just a simple large one, the surgeon will actually just insert a small needle into it and aspirate the fluid out. But you need to be aware of that possibility. If you start getting any leakage or drainage out of the incision that you didn't have before, if you notice a swelling in a particular place, you certainly want to seek medical attention. And having seromas increases some risk of infection, and that's another thing you want to watch out for, infection. If any pus oozes out of your incision, if you develop a fever, if your pain changes, if you have increased heart rate, if your wound opens, fluid draining from the site, redness, warmth, or swelling that wasn't there before, do seek attention. One of the things that can really help with seroma formation is to wear your compression garment as prescribed. So that's kind of all the, I don't mean to be scary stuff, but stuff you need to know about. Just on the very practical side, I honest to goodness feel so much better than I expected. I've been walking around outside, enjoying it, probably walking up to 3, maybe even 3.5 miles an hour, using my body and my brain as the guide, because I think my body wants to do more than I'm quite ready for. Doing a few little wall push-ups. I tried to do a couple of little leg lifts, and that didn't feel good, so I'm not doing that anymore. My surgeon expressly told me not to do sit-ups, so I'm staying away from those. And use your body as your guide. So I hope that these are helpful to you. My intent is to help you make good decisions about potentially having this surgery for yourself, or what to look for, what to watch out for along your recovery. And also, if you want to know more about what I do and my weight loss and wellness coaching, please go over to www.onceandforeverwellness.com and enter your email and first name, and you'll get weekly tips right into your email. I make weekly videos for people on my mailing list. It's great tips for maintaining your weight or losing weight and leading the most health-filled life that you can possibly lead. I will get back to you in a week or two and show you how things are going and activity and what's going on there. In the meantime, if you've got any questions, any comments, please post those below this video and I will get back to you. Thank you so much for your time, and I wish you the best.